by wealthy Canadians. The Saudi royal family gets all their medical care there.
Okay.
Excellent.
Henry Ford Hospital in Michigan,
I'll trade you for it.
There you go.
MD Anderson, wealthy patients from Central and South America. Canadian Premier Danny Williams, much to the protest recently of the Prime Minister of Canada, traveled to Duke to get his heart surgery. How does it all get paid for? Well, we have a private health insurance system, which the majority of Americans, is sponsored through their employer or purchased individually from those self-employed or self-insured. And then we have individually funded but government-administered health insurance, such as Medicare for those who qualify by age, TRICARE and VA benefits for those who have served our country in the military, and Medicaid, which is heavily subsidized by the government for those deemed unable to afford health insurance. And then there are the millions of Americans who are uninsured, about 60 million by some estimates. Our current system has really always had two major flaws. All the parts are not accessible to all the people, particularly preventative care for the uninsured. And the other problem with our system is it's expensive. Costs are rising. Currently, we're struggling to pay for it all. And we all know that government-managed Medicare is rapidly approaching bankruptcy. I'd like to make one thing clear. Although our current system isn't perfect and it's expensive, no one in the U.S. goes without health care at the time when they absolutely need it. If you suffer from a heart attack, you get treated. If you have a kidney stone, it gets removed. If you're diagnosed with cancer, you get the surgery, chemotherapy, or radiation treatment that you need regardless of your ability to pay. Emergency rooms and hospitals take the patients in. Doctors and surgeons perform their duties, and we all absorb the costs. The bills may come later, but the care is delivered. Where our system falls short is in access to preventative care. Seeing a doctor on a regular basis to identify and manage chronic medical problems. Some of this is driven by a lack of health insurance. Some of it's driven by, unfortunately, our community's lack of foresight to seek regular checkups and select appropriate lifestyles before they get sick. Now, we've all heard the heartbreaking stories, and I've certainly heard them in my practice, and I hate to list them for fear of leaving someone out, but insurance companies, most of them involve either insurance companies not providing coverage for pre-existing conditions, companies dropping coverage for individuals or children when their care becomes too costly, lifetime caps placed on benefits, skyrocketing premiums and deductibles, stories of individuals losing insurance coverage after they have lost their jobs in our current economic crisis, families burdened with large debt after a family member gets sick. It comes down to the fundamental problem of maintaining our current quality of medical care, making it accessible for all, still finding a way to pay for it. As I mentioned before, medicine's gotten extremely expensive. Most of this has come from a combination of advances in technology, the cost of medication and the cost of operating hospitals and medical practices. All these costs over the years have gone up. When we look at pharmaceuticals and medical devices, these things are just inherently expensive. They're produced by companies that have enormous research and development costs, payrolls to make, shareholders to answer to. And shareholders is sort of a dirty word lately, but if you really look at it, those shareholders are us. Most of us have, or many of us have 401ks, pension plans, retirement accounts that directly depend on the success and solvency of many of these American companies. Also, don't forget that these companies employ tens of thousands